Hello all, welcome to yet another session in pathology. So now we are going to continue with our second part of the stains in pathology. I hope in first part we have discussed about what are the stains we used commonly, that is the hematoxylin eosin staining. We have also discussed about that various intracellular accumulation staining, that is lipids, calcium, copper, iron. Fine? Yes. So I hope you are clear with those stains, and in that session let me give you a quick recap. The most commonly used stain is hematoxylin eosin, and for copper we have rhodamine. Yes. Can you name one another stain for copper? It's orzine. Very good. Then for melanin we have the most standard stain is Mason-Fontana. We have also Morel staining, SCHMORL''S. Okay, Morel staining, and we have what for iron? What is the gold standard? Pearl's Prussian blue. Very good. Then we have fat, we have oil red O, Sudan black B. For calcium, we have von Cozza. Von Cozza is most commonly used, whereas what is the most specific stain for calcium? It is alizarin red. Okay, coming to the part 2, stains in pathology. Here we are going to concentrate what are the stains for the connective tissue. Am I right? We have collagen, we have muscles, we have elastin, okay, we have reticular fibers, okay, we have myelin, okay, we have elastic fibers, okay, all those we are going to see, the cartilage, all those we are going to discuss in this session. Okay, fine. So let us start with the very first and a very beautiful stain. This is a Mason trichrome stain. What is it? Mason trichrome stain. Why it is called trichrome? Because it is going to stain 3 different colors differently. Fine. See, as you can see in this picture, what are the stain? It is mainly used to distinguish collagen. Okay, it is used to distinguish mainly the collagen from the muscle in the tissue specimens. Fine. It is mainly used to differentiate between 2 structures. One is muscle and another one is what? The collagen. As you can see here in this picture, the collagen, no, see, you can see the color of the collagen. What is the color of collagen? Blue. Fine. And you can see the muscles which are stained red. So, and of course we have one another color, that is the fibrin, okay, which is pink. So pink, blue, red, collagen blue, muscle red, and the fibrin as pink. That is why we call it as a Mason trichrome. 3 colors. Fine. Yes. So it is mainly used to differentiate collagen from the muscle. Fine. Then we have and one other stain that is called as Gomori trichrome stain. What is it? Gomori trichrome stain. Okay, here what is the difference between Mason trichrome and Gomori trichrome? Here in Mason trichrome, I told you that the collagen will be stained blue in color. See here, as you can see here, all this, what is the color? It is green. Okay, see, you can see the green. So in Gomori trichrome, see, all these are very, very important. All these are 5-star. Okay, all these are 5-star MCQ questions in your upcoming next exam or next or whatever be the exams. These are very potential. These are not normally given in Robbins or any other book. So these are somewhat high-level concepts, but without knowing this, you can't understand the further concepts. And for example, in muscle pathology, everything we will use these stains only. Fine. Yes. So collagen green in color in Gomori trichrome. Fine. Yes. Coming into another stain that is called as Gordon and Sweet reticulin staining. Actually, this question was an AIMS PG entrance exam question. Okay, previous year question. What is this sweet reticulin staining? The specimen here, it is of a liver. Okay, in liver. Fine. It is usually mainly to see the liver pathology. Okay, liver histopathology. That is in case of liver fibrosis, wherever there is a deposition of over deposition of the reticulin fibers in the liver stroma or the parenchyma. Here the reticulin fibers will stain black in colors and nucleus will stain red in color. You can see, the black color structures. Yes, these black color structures, you can see these are the reticulin fibers. What is the stain used? It is called as Gordon and Sweet reticulin staining. Okay, yeah, it's sweet. Both are the name of the scientist. Fine. Okay. Then we have another one, we call it as a picrocereus red. Okay, this is again the 3rd stain. So collagen, there are around 4 to 5 stains are there. First one we have discussed Mason trichrome, collagen will be blue. We have Gomori trichrome, collagen will be green. We have picrocereus red. As the name indicates, the collagen, as you can see here, it is red in color. Okay, red in color. Collagen stains red in picrocereus red. Okay, and remember the picrocereus red is mainly used to stain the collagen in paraffin embedded tissues. That means we will take the specimens, after that we will paraffin is wax. So we will embed the specimen within the wax, and in such a case we can use paraffin picrocereus red for staining the collagen. Fine. Yes, in paraffin embedded tissues. Yes. Then we have, so this is my most favorite stain. Okay, this is the most favorite stain. Why this is my most favorite stain means this looks so beautiful. Fine, yes, it is a pentachrome stain. We have 5 colors here. Okay, yes, this is mainly used in case of cardiovascular and pulmonary pathologies. Okay, to assess the vascular remodeling. And here we have 5 stains. That is why it is called as pentachrome. See, as you can focus on this picture, as you can see, focus on the pictures. Here you can see black colors. These black colors are elastic fibers. Okay, yes, and you can see some blue colors. Yes, blue means what? Of course, mucin. Very good. And you can see the muscles which are red in color. Fine. Muscles which are red in color, and we have something what we call it as the collagen. See, as you can see here, the collagen here, they are yellow in color. See, collagen, they are yellow in color, and we have fibrins which are bright red in color. So this is why it is called as what is Movax pentachrome. Okay, this is one of my most favorite things. Why? Because the picture looks so beautiful. That is the reason. Fine. Okay. Once that is done, we have go to the next stain that is called as Orzine. Yeah, of course, this Orzine, yesterday we have discussed about it, is going to stain not copper, pure copper. Pure copper will go for rhodamine staining. This is usually used to stain copper associated proteins. Okay, copper associated proteins. Okay, this is a potential MCQ question. What is the stains for copper associated proteins? Okay, I am going to draw an eye here. Please open your eyes here when you come to this. Okay, when you come to this area, it is copper associated protein. Okay, copper associated protein, we have what we call as Orzine. And remember, it is also used to stain the elastic fibers as well as the hepatitis B antigens present in the liver. Okay, and it will give a ground glass appearance. Okay, and just remember, it is used for elastic fibers as well as for copper associated protein. And you can see here in this picture what is the color of the elastin. Yes, the color of the elastin, can anybody appreciate? Yes, the color of elastin. The color of elastin is almost like a brownish red. Okay, color is almost like a brownish red color. Fine, that is the Orzine for copper associated protein. That is the first MCQ. The second MCQ here is brownish red. That is for the elastic fibers. Fine, yes, elastic fibers are brownish red in color. Once that is done, we come to the last stain that is called as, this is the name, okay, this is PTAH. What is it? PTAH. Okay, this is standard abbreviation. This is asked again in one of the Central Institute exam. I think it is PGI. In PGI, they have asked this question. What is PTAH? It is phosphotungstic acid hematoxylin. Okay, it is a mixture of hematoxylin along with the phosphotungstic acid. It is mainly used for staining collagen as well as muscle fibers. Fine, and remember, it is the ideal stain for demonstrating the striated muscle fibers as well as for mitochondria. We have a lot of mitochondrial pathologies like Leber's hereditary neuropathy. Okay, yes, mitochondrial myopathies, all the mitochondrial disorders. You know, mitochondrial disorders are maternally inherited. So mitochondrial disorders, all this we will use PTAH because it will stain specifically the muscle as well as the striated muscle fibers. As you can see here, the fibrin or the striated muscle fibers, you know, all these will appear like bluish in color. See, you can see it is dark blue in color. Am I right? Yes. Whereas the collagen will stain brown or red in color. That's not a big issue here. Just remember, striated muscle fibers, all this will stain blue in color. Okay. Yes. So I think with that we will come to the end of this video. Yes, can you identify what is the stain picture shown here? It is Movax pentachrome stain. Can you say what is this black color? Black color is, yes, I am going to write here. Yes, repeat with me. Black color is elastin, elastic fibers. What is this blue color? Mucin, very good. What is this yellow color? Collagen, super. What is this red color? Muscle fibers. Fine, yes, and fibrin we will have somewhat pinkish in color. Fine, yes. So these are the 5 stains. That is why it's called as Movax pentachrome stain. What is Mason trichrome? Yes, can we have a quick recap again? First, Mason trichrome, collagen will be blue. Gomery trichrome, collagen will be green. Gordon and Sweet reticulin stain, that is actually for liver pathology children. Very, very important. It's a gold standard MCQ question. Okay, it's gold standard, a very VIP question for you. Okay, it is all, I think one after another. In the frequent intervals, they will be asking in all the Central Institute exams. Okay, your UNICET exams, they will be repeatedly asking this. That is Gordon and Sweet reticulin staining for liver histopathology. Reticulin fibers will be black in color. Picrocereus red, collagen will be red in color. Movax pentachrome, I have already told you. And we have Orzine. Orzine is what? For copper associated protein, as well as again for elastic fibers. Okay, yes, elastic fibers, it will be brownish red in color. And we have PTH for mitochondrial disorders, as well as for striatal muscle fibers pathology. In order to visualize it properly, we will use the phosphotungstic acid hematoxylin, PTAH, 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 repeatedly asked question. Fine, yes. Fine, that's done. And okay, I think that's the end of this chapter. So please go through these. These are very common stains. See, if you are familiar with these stains, why I am teaching this now? Because if you are familiarized with these common stains, there is no need that you should mug up all these stains. Okay, whenever it comes into, for example, we are studying in liver pathology, we are studying Wilson's disease. Fine. Okay, you know that what will be the stain. Of course, it is rhodamine. In rhodamine, you know how the copper will look like. You know, it's brownish red in color. Fine. Modified Fauchet. It is for bile pigments. The bile will be emerald green in color. You know already. Okay, in hemochromatosis, what will be the histopathology? We will use Pearl's Prussian blue. The iron will be what? Blue in color. That is ferric ferrocyanide is the compound which is giving that Prussian blue color. So you already know the concept. So once you know that, there is no need that you can mug up. Okay, if you know that, suppose if you don't have time during your exam to go through the histopathological features of Wilson's disease or hemochromatosis, okay, all those steps, okay, you know, yeah, this is the state we are using. If you write that, that itself will fetch you good scores. Fine. That is the reason we are, see, basics are always basics. These are very basic fundamentals in pathology. If you are very good at staining, if you know what is actually we are doing in a pathology, okay, how will be the features, what are the common features, if we say for a cancer means what will be the common features, for a what infectious diseases means what are the common features we can write. Of course, all diseases will vary only by some 1 or 2 points of difference. The rest, everything will be normal. Almost all the pathogenesis are normal for all cancers. So if you know the basics and fundamentals very thorough, if it is crystal clear for you, it will be extremely very easy for you to learn all the pathologies of all the diseases in Robbins. Fine, you should know all the diseases in Robbins. Okay, for that, this is a basic fundamental. Thank you.